Thank you so much, Mariola. It's fantastic to be here with you all today. As she just said, my name is Perrin Robinson. My pronouns are he, him, and I'm a clinical research specialist at the National Center for School Mental Health at the University of Maryland School of Medicine. So I'm really excited to be here with you all today. I'm going to introduce a little more about myself. I'll be talking then about some terminology in regards to LGBTQ plus youth to just kind of make sure we're all on the same page about what we're talking about. From there, I'll be moving into different types of discrimination that LGBTQ plus youth experience, and then the health outcomes that they face as a result of that. So my background is in clinical psychology. I have a master's degree from Loyola University, Maryland. But for the last 6 years, I've been doing school mental health program evaluation and research and communications at the University of Maryland School of Medicine. I also teach part-time in the psychology department at Loyola University. And I'm really interested in learning more about and teaching about inclusive data collection methods, what we know about LGBTQ plus wellness, how intergroup bias and discrimination affects different groups of people, things like that. So again, super excited to be here today. Let's go ahead and jump into this terminology section. So it's possible some of you are already super familiar with all of these terms, and that's great. And some people may have heard a lot of these terms before, but there might be some confusion about where they overlap or what they mean. So I just want to make sure we're all on the same page about everything as we move forward. So first, when we say sexual orientation, of course, this is an important component of LGBTQ plus youth. Each one of us has a sexual orientation, whether that is straight or asexual or bisexual. I've listed a bunch of common ones there: straight, gay, lesbian, bisexual, pansexual, asexual, demisexual. If you're not familiar with the difference between bisexual and pansexual, those are similar terms. Bisexual is a term indicating attraction to two or more genders, and pansexual is a term indicating attraction to, it could be to anybody. Gender is not a factor in attraction there. So many people experience sexual orientation with physical and emotional attraction lining up. But some people experience that a little bit differently. For example, somebody could be bisexual and experience physical attraction to men and women, but consider themselves heteroromantic, where they may only feel emotional attraction or falling in love with someone of a different gender. So that's sexual orientation. Gender identity is your internal sense of being a man, woman, neither, or both. So this is how you identify. It's not about your body, it's about who you are as a person. So a man, woman, someone could be agender, meaning that they are not on these gender spectrums. Their existence kind of is outside of our world of gender. Non-binary, genderqueer, and other types of gender expansive, diverse, and non-conforming folks. So that is contrasted then with sex assigned at birth. Sex assigned at birth is just the box that is checked off on somebody's birth certificate, which is usually male or female. We see here also, actually, can we go back one slide quickly? Sorry, I just want to make sure I get all those. Oh, and then gender expression is our outward expression of our gender, which can be more feminine or masculine or androgynous, which is a mixture of both. Sorry, thank you, Mariola. So those are all some big important terms. Just a few more. We can experience gender by being either cisgender or transgender. So cisgender people means sex assigned at birth and gender identity match each other. So the box male was checked, you are a man, it all fits. Someone who's transgender, those don't match up. So maybe the box male was checked and you are maybe a transgender woman or maybe an agender or non-binary person. So that all falls under the umbrella term transgender. One of the ways that we express our gender is with pronouns. So for many people, using she, her, hers if you are a woman, or he, him, his if you are a man fits. Many people who are agender or non-binary use they, them, theirs. But some people who are agender or non-binary can also use she, her, hers, or he, him, his. There are also another category of pronouns called neopronouns, which are pronouns that people use that exist outside of he, she, and they. So those are not quite as common, but they are definitely out there. People use them, and it's important for us to be respectful of them. And then finally, two-spirit is a term that describes some Native and Indigenous queer individuals. So not all Native and Indigenous queer people use the term two-spirit, but many do. And when you see that term, you can know that that's what it's referencing. To kind of put it all together here, you can see this gender unicorn. So for gender identity, you see that there's a spectrum for each different category. So gender identity, woman spectrum, man spectrum, other spectrum. Same for gender expression, feminine, masculine, and other, sex assigned at birth. We have our physical and emotional attraction there too. As I said, some people experience sexual orientation with physical and emotional in slightly different ways. And then finally, these are some terms that are kind of catch-all terms for anyone who is LGBTQ+. So of course we have LGBTQ, you might have seen LGBTQIA, they will sometimes have a plus after it, sometimes 2S for two-spirit is thrown in there. Another term is SOGI, which sometimes but not always has an E at the end of it. That's sexual orientation and gender identity and expression. The term queer, which has historically been used to marginalize and discriminate against LGBTQ+ people, has largely been reclaimed in LGBTQ+ communities. Not everybody is a fan of that term. Some people still have a dark history associated with it, but other people are happy to use it and adopt it. And then SGM or GSM is sexuality and gender minorities. So as I move on here, I also just want to say, if you do have questions for me as we're going, feel free to put them in the chat. If I am able to get to them in time, I'm happy to do that. And then if not, I think after this meeting, we're going to have a way to connect and get me connected with people who have had questions. So feel free to put them in the chat as you have them. I will get to them if I can. So we just talked about all these different ways in which we experience and label identity, but a lot of time people's experiences exist outside of these labels that we've created. So these labels can be super helpful, but that doesn't mean that everybody fits perfectly into these labels. So who we are is expansive beyond these boxes. Some examples of that here from some celebrities, JVN or Jonathan Van Ness is non-binary, uses any pronouns. So we were saying earlier that pronouns and gender identity don't always match. So just because somebody's non-binary, it doesn't necessarily mean they only use they, them pronouns or neo-pronouns. Jonathan is fine with any pronouns. Comedian and influencer Sarah Schauer is a lesbian and also a non-binary woman, uses she and they pronouns. Rapper Angel Hayes is pansexual and agender, uses any pronouns. Actor Ruby Rose is gender fluid and uses she, her pronouns, and at one point considered being transgender and has decided to continue identifying as a woman. There's a drag queen, Gottmik, who is a pansexual transgender man, uses he, him pronouns out of drag and she, her pronouns in drag, which is something that many drag queens use. So now that we have that context a little bit about what it means to be LGBTQ, some of these main terms, I'm going to talk a bit about the discrimination and the experiences of LGBTQ+ people. And it's always a little tricky to bring this up because LGBTQ+ people are also living life to the fullest and creating amazing art and having rich, fulfilling lives. But for the purposes of this presentation, I am focusing mostly on the difficulties experienced by LGBTQ+ people, what those look like, and what sort of impacts they have. Since I know all of you are here because this is something you're invested in, helping to make people's lives better. So it's important for us to cover that today. So one of the courses that I teach is social psychology, and in that course, we do talk about intergroup bias, which consists of stereotypes, discrimination, and prejudice. So those are three different ways in which bias kind of comes together in how we treat different groups of people. So it's called intergroup bias because these are three types of bias that we hold toward groups of people that we're not a part of typically. So stereotypes are our thoughts and cognitions, our beliefs about other groups of people. Prejudice is our feelings and our attitudes, and then discrimination is the behavior. So the discrimination can be something that's interpersonal, like a microaggression or some sort of comment or rudeness, or it can be institutional, it can be systemic, it can be political. It's often worked into policies in one way or another. And this intergroup bias becomes particularly harmful when groups are experiencing different levels of power and privilege. So power is the ability to control the outcomes of others by providing or withholding resources. So when we have groups that have more power than others, and the groups with more power are engaging in intergroup bias and have stereotypes, discrimination, and prejudice against groups with less power, that's when we really start to see some harmful effects of that intergroup bias. Privilege is a related term. Typically, people who have more power have more privilege, and people who have less power have less privilege. But privilege you can have in any sort of domain. There's a wheel of power and privilege I think you can see there on the right, where you can see many different domains, and towards the center of the circle, you can see which groups of people have more power, and as you move out, you can see which groups of people have less power and are more marginalized. And when we're talking about power and privilege, it's important to recognize that we're not just talking about one thing happening at a time. So I'm talking about the discrimination that LGBTQ plus people experience today, but many of these people are also experiencing discrimination, stereotyping, and prejudice because of the country they come from, or the language that they speak, or the color of their skin, or their age, anything like that. Whether they have a disability, all of these things group together, and that's what intersectionality is. Kimberly Crenshaw is a lawyer who coined this term, a theoretical framework for understanding how aspects of a person's identities combine to create unique modes of discrimination and privilege. So I just want to make clear here, intersectionality is not just about when we have multiple identities, it's about how these identities are connected to discrimination and what sort of issues arise when we have overlapping levels of discrimination. So I just want people to be keeping this in mind as we're continuing with this teaching today. All right, so you know what intergroup bias is. Now let's talk specifically about some ways that LGBTQ students experience it. So we have some large overarching systems that are reinforced in all sorts of different places in the US and across the world. The main two here are cissexism and heterosexism. So I used the word cisgender earlier to explain people whose gender identity matches their sex assigned at birth. That's the majority of people. So we structured this world to benefit people who are cisgender and to hurt people who are transgender. So when we're talking about cissexism, these are the systems, policies, and practices that promote and reward being cisgender and ignore and punish being transgender. Along with that, we have the ideas of cisnormativity, saying that being cisgender is what's good and correct, and transphobia, which is a fear of or aversion to transgender people. Related to cissexism, we also have heterosexism. These are systems, policies, and practices that promote being heterosexual and ignore or punish being homosexual. So along with that, we have heteronormativity, which states being heterosexual is what's good and normal and default. And we also have homophobia and biphobia, which is an irrational fear or aversion of gay people and also bisexual people. And biphobia is a very real, serious problem that directly affects the mental health of a lot of bisexual people. And I do want to put in a quick note here that a lot of cissexism and heterosexism is very directly related to Western colonization. A lot of cultures and societies pre-Western colonization didn't have cissexist or heterosexist practices and policies the same way we do. And historians have done some research and found that countries who have experienced Western colonization have statistically higher numbers of homophobic and transphobic laws than other countries do. So just wanted to share that. So some of the ways in which these can occur in the lives of LGBTQ students can be through families. We know that families play a really important role in the well-being of young people. There's a group out of San Francisco State University called the Family Acceptance Project, which specifically focuses on the roles of families and LGBTQ young people. And they've identified that when LGBTQ young people come out, every behavior that their family does toward them can be either accepting or rejecting. So Students who are experiencing rejecting behaviors from families are also often experiencing worse health outcomes. So these rejecting behaviors can include preventing their child from connecting with other young queer people, not using or respecting their child's name or pronouns, trying to change their child's identity, maybe through conversion therapy or some other means, physical or emotional abuse, controlling how the child dresses, acts, or behaves, or making the child leave their home. So we know that through education, families can become less rejecting and more accepting, but still a high prevalence of rejecting behaviors is one area in which LGBTQ youth face a lot of stress and pressure. And I just mentioned that families making young LGBTQ people leave the home is a problem. We see that in housing issues. We know that LGBTQ plus youth are 120% more likely to lack housing than their peers who are cisgender and straight. They both get kicked out of their houses at higher rates and also have a harder time finding other housing. Especially young transgender people may experience discrimination in their search for housing after being forced to leave their homes. In addition to stressors at home, we also have stressors at school. So most students have heard some form of homophobic remarks in the previous year. This is from research from 2018 and 2019. And half of LGBTQ youth had heard homophobic remarks from teachers or other school staff directly. So this is not just coming from students. 87% heard transphobic remarks. Over half of LGBTQ youth were sexually harassed at school in the year prior to this. And just under half avoid bathrooms and locker rooms out of concern over experiencing harassment, bullying, etc. So we see that there are unfortunately fairly high rates of students experiencing physical harassment, physical assault, and verbal harassment all at school, whether that's for their sexual orientation or their gender expression or their gender identity. So we're seeing students experiencing stress at home, we're seeing them experiencing stress at school. Another area where many people can go to help when they have issues of stress or other types of health concerns is the healthcare system. But unfortunately, LGBTQ plus people experience discrimination in the healthcare system as well. And this discrimination actually leads people to feel stress and anxiety over healthcare visits, which prevents them from accessing healthcare in the first place. So we all know that prevention is often a really helpful tool and can be more effective than intervention, but people are not able to go seek out the preventative care that they need in the first place. So they're waiting until healthcare issues become more exacerbated before they start receiving help. Along with this, I just want to say that there has been a huge push to reduce access to gender-affirming healthcare for young LGBTQ people, especially young transgender people, in the last 2 years at the state level. And when we talk about gender-affirming healthcare, a lot of people tend to think that that's hormone therapy and surgeries, but it is a lot more than that. It's also puberty blockers, speech therapy, primary care, mental health therapy. All of these things go into this package that we call gender-affirming therapy, and it is associated with improved mental health and reduced risk of depression and suicide, especially for transgender young people. In addition to all of this, there are often laws and policies that fail to protect LGBTQ young people, at least to the extent that they need. So anti-discrimination policies and laws are really crucial and really protective. There's some evidence that shows they may be even protecting against suicidal ideation and attempts. There have been some bumps in calls to suicide hotlines from LGBTQ people when there are state level laws that are passed that are discriminatory. And even right now, there's a huge push for state level discriminatory laws that are really targeting transgender and other queer young people. So that includes removing them from athletics, blocking access to gender affirming healthcare, and preventing the discussion of queer identities in school settings. So all of these together, these stressors all combine. They're cumulative, they really wear on people, as I'm sure many of you know or have experienced in your own lives, and these end up leading to a lot of health disparities that LGBTQ young people experience, physical, mental, and behavioral. So I'm gonna go ahead and take us through what some of those health disparities look like. So across the lifespan, we in general see health disparities for people who are LGBTQ+. We see that due to this discrimination and lack of access to healthcare or reduced access to healthcare, they have higher rates of a lot of health and mental health concerns. And within LGBTQ+ people, it's not a monolith. We see that in different subgroups, there are different types of concerns as well. We know that people who are bisexual, asexual, transgender, and individuals of color are more likely or at higher risk to experience these negative health outcomes. Sexual minority adults, so that means gay, lesbian, asexual, bisexual, pansexual, are more likely to experience mental health and substance use issues than their peers. And we also know that this cumulative stress from discrimination can really wear on people. And there's some research that shows that that can even affect the duration that somebody lives and their overall health through telomere length in your chromosomes. So there are all sorts of different ways in which this is affecting our health. And I'm going to go through these in a little bit more detail now. So first, looking at mental health disorders. As of last year, LGBTQ youth, now keep in mind, this is during the pandemic. So a lot of LGBTQ youth are dealing with the stressors associated with being queer that we were just covering, the stressors of being in a pandemic, which we were all experiencing in different ways, most likely. And then sometimes this was combining and people were now having to deal with rejecting family members or abusive family members that they no longer can get away from by going to school. So a lot of problems were being exacerbated during COVID-19 and are still being exacerbated. So 72%, almost 3/4 of LGBTQ+ youth were experiencing symptoms of general anxiety disorder, and over 3/4 of trans and non-binary youth had symptoms of generalized anxiety disorder. 62%, just under 2/3, had symptoms of major depressive disorder, and again, over 2/3 of transgender and non-binary youth had these symptoms. Nearly half wanted to receive counseling from a mental health professional, but were not receiving it for whatever reason. And 70% of LGBTQ youth said that their mental health was poor almost most of the time or all of the time during COVID-19. We also see higher rates of PTSD. When people experience abuse, that can result in trauma and post-traumatic stress, as I'm sure you all know, and not even necessarily, it doesn't even have to be like acute abuse, but this can be the result of accumulation of discrimination, microaggressions, things like that. So about 10%, just under 10% of LGBTQ youth are meeting the criteria for PTSD. Around 4% is the national average, so we see a much higher rate there. And we do see that those rates change based on race and ethnicity, with higher rates for Black LGBTQ+ youth and lower rates for Latinx LGBTQ+ youth. Same with depression, about 8% of youth experience depression on average, but it's about 15%, almost double the rate for LGBTQ youth. For there, it's a little bit lower for Black LGBTQ youth, quite a bit higher for white LGBTQ youth, and again, still lower for Latinx LGBTQ youth. And in general, when we're talking about mental health, we consistently see that young people who are bisexual or transgender have worse mental health outcomes than young people who are even lesbian or gay, who are also having worse mental health outcomes than their straight and cisgender individuals or counterparts. And some new research is also showing that asexual people are having these also higher rates of mental health concerns and mental health disorders. So depression and anxiety, of course, these are really big, heavy topics. Suicide is another issue, another thing that is plaguing lots of queer young people. These rates are, it's really heavy and dark how high these rates are. So almost half of queer high schoolers considered dying by suicide. This was in like the, over the last few years. And almost 1/4 did attempt suicide in the previous year. This is much higher than their cisgender heterosexual peers. We also know family acceptance plays a huge role here. Youth whose families highly reject their sexual orientation are 8.4 times more likely to have attempted suicide. We also know that when families use and respect the youth's names and pronouns, it cuts suicide attempts in half. So we are seeing some positive things there for how we can reduce this. Excuse me. So suicide attempts, we know that they're much higher for LGBTQ people. We see that they're higher for gay and lesbian people, even higher for bisexual people, even higher for transgender people. Nearly half of transgender people attempt suicide at some point in their lifetime. About 20%, 1 in 5 of LGBT people do this, and it's just under 5% of the general population. And you can see there, I'm assuming these slides will be available for people later on, but you can see that different subgroups of transgender individuals are also at even higher rates. All right, I know I just have about 1 minute left, so I'll be wrapping this up fairly quickly. We also see higher rates of substance use and sexually transmitted infections in LGBTQ youth. There are still stigma and effects from the AIDS epidemic and the government response to it. LGBTQ plus people experience STIs at higher rates. We also know that coping with this distress and discrimination causes them to use substances at higher rates. They're more likely to suffer from a substance use disorder, and when they enter substance use treatment, have more severe disorders than their cisgender heterosexual peers. So I'm not going to read through all of these, but research, we have a lot of good research on this nowadays, and we've identified many risk factors that are going to put queer people at higher risk of poor health outcomes, and a lot of protective factors. This is going to help people with anxiety and depression and suicide attempts. So putting this all together, we see that people experience marginalization and discrimination for being LGBTQ+. As a result of that, we have these poor mental health outcomes, or they're at higher risk for mental health disorders. And then this is also going to impact their academic functioning as well. So when people are distressed and in distress and experiencing psychological distress, it affects their academics, and those suffer as well. So I know it is 3:30. That's all I have time for right now. So I really appreciate you all being here today with this. And again, I'll be available for questions that you have for me can be sent my way later on, and I'm going to pass it back to the next person.